Hello, everyone. My name is Nikita, and the topic of this presentation is lung cancer nodal staging using EBIS elastography and artificial intelligence, a pilot study. I have no conflicts of interest to declare, and here's a brief overview of the sections we'll cover. The current diagnostic pathway for non-small cell lung cancer includes the staging of mediastinal lymph nodes. The nodal stage helps determine the extent of the disease and treatment decisions, so it is a crucial step in the diagnostic pathway. The current standard for mediastinal lymph node staging is endobronchial ultrasound transbronchial needle aspiration, or EBIS TBNA. Despite many advances in EBIS, as high as 40% of nodal biopsy results are inconclusive, and this often leads to repeat biopsies and delays in treatment. The low yield may explain why many practitioners are skipping this step altogether. In fact, in a study conducted on 2,916 lung cancer patients, only 22% actually received mediastinal staging. So are there any imaging adjuncts to improve the EBIS TBNA diagnostic yield? Elastography is a novel technology that produces a color map to visualize tissue elasticity, where stiffer areas are depicted in blue and softer areas in red. Malignant tissues, which contain more cells per area than normal tissues, are stiffer in nature. In terms of lymph node staging, malignant lymph nodes are expected to appear predominantly blue, where benign lymph nodes are expected to appear predominantly red. Stiffness area ratio is the most intuitive quantitative method to analyze elastography color maps. Stiffness area ratio is a proportion of blue relative to all the other colors seen in the lymph node region of interest. Now let's apply this formula to a lymph node. Here we see a benign lymph node, which we expect to be predominantly red. Since there is a smaller proportion of blue, the stiffness area ratio will be relatively low. Now let's take a look at a malignant lymph node. Here we expect it to be predominantly blue. Since there's a larger amount of blue, this increases the numerator and in turn the overall stiffness area ratio. However, this is a relatively new technology, so what has not yet been explored is defining the numerator in a reproducible and quantitative way. What exactly constitutes blue? The research question we're trying to answer is using a deep neural AI network to analyze elastography color maps. What is the optimal blue color threshold that can be used to calculate the stiffness area ratio to accurately predict lymph node malignancy in non-small cell lung cancer patients when compared to the biopsy results of EBIS TBNA? We have two research aims. The first is to define the color threshold of blue that should be used to compute the stiffness area ratio. And the second is to define the optimal stiffness area ratio that can be used to differentiate benign and malignant lymph nodes. Patients with suspected or diagnosed non-small cell lung cancer requiring EBIS TBNA were eligible. We had 31 lymph nodes from 16 different patients. Patients underwent the EBIS TBNA procedure, and prior to conducting the biopsy, EBIS elastography was also performed. The images were captured and stored. In regard to imaging analysis, NeuroSeg, an artificial intelligence deep neural network, was trained by our research group to segment the lymph node on the B mode image. The segmentation was then overlaid on the elastography color maps to extract the color information. 9 different thresholds on the 0 to 255 color scale were analyzed. The blue threshold was determined using the receiving operating curve and the area under the curve. Stiffness area ratio was determined using diagnostic statistics. Here are our patient demographics. Majority of the lymph nodes were sampled from station 7 and 4R. There were 17 benign lymph nodes, 13 malignant, and the pathology could not be obtained for one of the lymph nodes. Here are the results of the area under the curve analysis. Of all the color threshold levels, levels 40, 50, and 60 had the highest area under the curve, and the receiving operating curves were significantly different from the other threshold values. Threshold level 60 was chosen as the optimal stiffness color threshold, or the blue threshold, as it had the highest area under the curve of 0.891. Now that we identified the blue threshold to be level 60, meaning our numerator of our stiffness area ratio is now the proportion of color at level 60 or above. We can now move on to determining the best stiffness area ratio cutoff to distinguish malignant and benign lymph nodes. Based on the data points of the receiving operating curve, 0.496 was chosen as a stiffness area ratio cutoff for two reasons. Firstly, it had the highest sensitivity and specificity. Secondly, it had the highest Uden index of 0.69, a summary statistic for the accuracy of the data points of the ROC curve. Based on the stiffness area ratio cutoff, the sensitivity was 92.3%, specificity was 76.5%, and the overall accuracy was 83.3%. The average stiffness area ratio for benign lymph nodes was 0.37, and for malignant lymph nodes, it was 0.67, and there was a significant difference between these two groups. So our main findings was the blue threshold level was found to be level 60, and the stiffness area ratio cutoff was found to be 0.496. In conclusion, AI-powered EBIS elastography is a useful adjunct to EBIS TBNA to determine the pre-test probability of the malignancy of a lymph node. Further prospective work with a larger sample size will be required to validate the findings of this pilot study. And with that, I'd like to conclude this presentation and open up the floor to any questions. Thank you for your attention.